Joining us now is Dr. Sivaranjani. Good morning, ma'am. Thanks so much for being with us on the program today. Firstly, I want to understand from you, we've been reading so much about your work, looking at your videos as well, and felt so inspired. I want to understand what propelled you to do such a selfless job in the first place. A lot of doctors would just like to stick to their practice and go back home then.
So I had this experience where my intern saved my life when I was choking on a gooseberry seed at some point during my training in JIPMA.
Oh.
And maybe subconsciously that acted on me. And I'm first a mother and then a pediatrician. And I feel every parent needs to be empowered with the right knowledge about first aid. And the other thing is 1/3 of the deaths in India in the under 5 age group, 1/3 of the deaths are due to diarrhea. Diarrhea causes dehydration, and appropriate rehydration is so important to prevent these deaths. And I am working on this for the past many years. There are companies which are selling their fruit juices as ORS.
Yes.
They have mislabeled them as ORS and selling them in every pharmacy. You get these juices, ORS, rebalance with ORS. They are not ORS. WHO recommended formula is the right ORS and rightly rehydrates the children. But what's happening is these companies, after taking permission from FSSAI, have labeled their drinks in such a way that people think that they are the right ORS. These drinks have a very high sugar content and they can worsen the diarrhea. And you know diarrhea can lead to death.
Yes.
So most children are drinking these drinks during diarrhea, and many diabetic patients in India are drinking these drinks during diarrhea. And I've been trying to educate parents, but that's not enough. I had written to FSSAI, Health Ministry, CDSCO, and finally on April 8th, 2022, they have issued an order that these drinks should not mislead the customers, and they should change their names. But I don't know what happened. In 3 months, the order was revoked and it has been changed to this. That is, companies with valid trademarks can continue selling their drinks with a disclaimer that they are not ORS. If you see here and if you see here, the ORS is displayed very prominently, very prominently. But these are not ORS, and the disclaimers, who is going to read a disclaimer?
Right. So ma'am, this is a very important point, and you're right about sugar actually making your diarrhea worse, that can take away lives. So can you tell us the difference between an actual WHO verified formula of ORS versus something else? Is there something that we can watch out for when we go and buy these for our kids?
Simple. Look at the label. It will be clearly mentioned that it's WHO recommended formula ORS. That will be written on the label.
Okay.
And this permission they don't get from FSSAI. So there is no permission from FSSAI on the label. Only WHO recommended formula ORS, and whatever permission number they get from the CDSCO will be mentioned on the label. So only look for WHO recommended formula ORS.